afternoon everyone, myself Dr. Kirti, Assistant Professor of Physiotherapy Department. So today we'll discuss about the hip joint. Hip joint particularly motion. So it is the articulation of concave socket of acetabulum of pelvis with convex head of the femur. It is a diarthrodial ball and socket joint with 3 degree of freedom, flexion extension in sagittal plane, abduction adduction in frontal plane, medial lateral rotation in transverse plane. So what is the angle of inclination? It is usually the angle formed between the head and neck of the femur with respect to shaft of the femur. Normally it is 125 degree. With coxa vara it is 105 degree, and with coxa valga it is 140 degree. Angle of torsion formed between the axis through femoral head neck and axis through distal femoral condyles. Normally it is 15 degree, and it is with anteversion it is 35 degree, and with retroversion it is 5 degree. So angle of inclination is shown in the first figure, and angle of torsion is shown in the second figure. Ligaments, the supporting ligaments are iliofemoral ligament, pubofemoral and ischiofemoral ligaments. So now we are having the hip motion. So the diarthrodial ball socket joint with 3 degree of freedom, and kinematics at the hip, femoral on pelvic osteokinematics, in which rotation is rotation of femur of fixed pelvis, and pelvic on femoral, in which there will be the rotation of pelvis or the fixed femur. So femoral on pelvis, hip flexion. With hip flexion, femur rotates anteriorly. With extension, posteriorly. With abduction, femur abduct laterally. With adduction, femur adduct medially. And with internal rotation, femur rotates medially. With external rotation, femur rotates laterally. Pelvic on femoral hip rotation. Associated increased lumbar lordosis, forward rotation of pelvis, lumbar spine flex, pelvis posterior tilt. So abduction of support hip occurs by hiking the iliac crest on side of non-support hip. Supralumbar trunk remains stationary. Lumbar spine must bend in direction opposite the rotating pelvis, and like towards the side of abducting hip. And adducted adduction of support hip, lowering iliac crest on non-support hip, cause lateral concavity within lumbar region on side of adducted hip. So internal rotation, support hip occur at iliac crest on side of non-support hip, rotates forward in horizontal plane. External rotation, iliac crest on side of non-support hip, rotates the backward in horizontal plane. So these are the references. Thank you.